Today I'm going to be talking to you about prostate cancer and testicular cancer. My colleague Dr. Pang has already discussed a bit about the diagnosis and treatment options of prostate cancer, and I will now elaborate more on that. I thought I will divide my talk into these following questions, which are questions that you may have regarding both prostate and testicular cancer. I'm going to talk about how common prostate cancer is, what is the risk of getting prostate cancer, how is it diagnosed, what is PSA, what is a prostate biopsy, some of which has already been covered by Dr. Pang, so I shall not go into much detail. But what I want to really focus my talk on is what happens once the diagnosis of prostate cancer is made, and what are the treatment options which are available today. So prostate is a gland which is located right beneath the urinary bladder. It's about the size of a walnut. It's not exactly clear what the function of the prostate gland is in human beings. It helps produce a liquid that helps nourish the semen. So this is a cartoon or a picture representing the prostate. As you can see, in the zoomed on picture, there is evidence of cancer in the prostate gland. And below on the right are some descriptions of what a prostate looks like under the microscope, a normal prostate, what an enlarged prostate looks like, called BPH, what is inflammation of the prostate looks like, and what prostate cancer looks like. Unfortunately, cancer continues to be the top cause of death in Singapore, and prostate cancer is the second most common cancer in men in Singapore. What are some of the symptoms that one may have if you have prostate cancer? You may have blood in the urine, you may have painful urination, you may have difficulty passing urine, you may have intermittent voiding, meaning when you go to pass urine, not all of it comes out, a sensation of incomplete emptying of the bladder, prolonged emptying of the bladder, and bone pain if the cancer, God forbid, has spread to the bones. But most often you have no symptoms at all. What about the risk of getting prostate cancer? Well, age appears to be the most important risk factor for prostate cancer, and if you look at multiple studies done in many countries, the older you are, the higher risk of you getting prostate cancer. And at least based on the American SEER database, majority of prostate cancers are diagnosed between the ages of 65 and 74. Your risk of prostate cancer also is high if you have a number of family members who are diagnosed with prostate cancer, especially close relatives, and if they are diagnosed at a younger age. In some situations, chronic infection of the prostate gland, which is called prostatitis, may also lead to increased risk of developing prostate cancer. And some studies suggest a Western diet, such as a diet with high levels of meat, dairy, and saturated fats, may be linked to the development of prostate cancer. More recently, with the availability of sophisticated genetic testing, we have shown that certain genes that you may inherit from your mom or dad increase the risk of developing prostate cancer. And these are some tests that we do routinely once a diagnosis of cancer is made. Again, very quickly, I know Dr. Pang has elaborated on this previously. Prostate cancer is usually diagnosed with a combination of a physical examination, a PSA, which is a blood test, as well as a prostate biopsy, as shown in these cartoons. So what is PSA to a Singaporean male? Well, at least as it relates to this talk, it stands for prostate-specific antigen and not the Port Authority of Singapore. Once you have seen a urologist such as Dr. Pang, you're found to have elevated PSA and you've had a prostate biopsy done, which unfortunately shows cancer. We look at further information from the prostate biopsy report. One of the most important components of this report is the Gleason scale, as shown in this cartoon. And this is essentially what the prostate cancer cells look like when seen under the microscope by the pathologist. And if they look very disorganized or high grade, you get a higher score, which is the highest being 5. And if it looks like a normal prostate gland, you get a score of 1. So the higher the grade, the more risk is associated with prostate cancer. Most prostate cancers fall between a score of 7 to 10. Gleason grade 6 or below is not considered prostate cancer by most experts. Now I'm really what happens next? So once prostate cancer is diagnosed, the next step is called staging, where we would want to see if the prostate cancer has spread outside the prostate, and if it has spread, what parts of the body has it spread to. And this is usually done with a combination of scans, such as an MRI of the prostate, a bone scan, a CT scan, or more recently, a more sophisticated scan called a PSMA PET-CT scan. Once, if the scans show that the cancer is not spread, still localized to the prostate, then we do accurate stratification of the cancer based on PSA, the Gleason grade, as well as the stage as highlighted below. Essentially, to put it simply, stage 1 prostate cancer, as you can see in this picture, is a small cancer localized to the prostate gland. In stage 2, you have usually more than one area, but still localized to the prostate gland. In stage 3, the cancer has spread outside the prostate gland to the neighboring tissues. And in stage 4, unfortunately, the prostate cancer has spread to other organs such as bones, liver, lung, etc. So clearly, a diagnosis of cancer is always associated with shock and anxiety, and there are a lot of questions that a man may have once he is diagnosed with prostate cancer. Am I going to have to wear diapers for the rest of my life if I undergo prostate cancer surgery? Will I have to stop working? Will this cancer come back even if I undergo curative surgery? Will this treatment be very expensive that will bankrupt me? Will I become impotent after the prostate cancer surgery? And if the cancer is advanced, will I die in pain? And hopefully today, during this session, we can answer some of these questions which naturally arise. The surgical aspect of prostate cancer treatment has been discussed by Dr. Pang extensively, so I shall not highlight this. But essentially, nowadays, we are performing robotic surgery to remove the prostate cancer, which is a more accurate way of surgical removal of the cancer. For those patients who are unable to undergo surgery for whatever reason, but still have the cancer localized to the prostate gland, we usually use radiation therapy to treat the cancer. And radiation therapy is essentially high-powered X-rays that damage the DNA of the cancer cell and thereby kill it. Now, this can be in the form of external beam radiation therapy, where the source of radiation is outside the body and is aimed at the prostate cancer or prostate gland. And this also has various techniques, including the new one which is called proton radiation. Or it can be radiation delivered into the prostate gland directly with the help of seed implants. That's called brachytherapy. So this is the example of external beam radiation, where the red color signifies the focus of the radiation X-rays to kill the cancer, thereby maximum damage to the prostate cancer and minimum damage to the surrounding tissues such as the bladder and the rectum. And in this situation, radioactive bead implants have been inserted into the prostate gland, and they release radiation over a period of time, thereby killing the prostate cancer, and eventually they are inert, so they do not trouble the patient. Lastly, for early prostate cancer, you also have the option of watchful waiting, meaning, let's say if the gentleman with the cancer is above 80-85 years of age, is frail, has other medical problems, but has a small, low-grade prostate cancer, we don't necessarily have to treat it all the time. We can just monitor it closely with regular checks of the PSA, and if we have any suggestion that the cancer growth pace is accelerating, such as rapid rise in PSA, we can re-biopsy the cancer and then consider treatment. So watchful waiting also is an option in certain situations. Now I'm going to switch to the next part of my topic, which is essentially part of my expertise, which is advanced prostate cancer. Unfortunately, we still diagnose about half of the patients with advanced prostate cancer. This is one picture of a patient spine, and these are the vertebrae and the spine, and all these white dots are prostate cancer cells that have spread to the spine. So I want to emphasize that having advanced prostate cancer is not necessarily a death sentence today. Fortunately, in the last 1 to 2 decades, there has been an impressive amount of research done on prostate cancer, and we have now the availability of multiple new treatment modalities to treat this disease. The primary treatment of advanced prostate cancer is hormonal deprivation. And this is based on an idea which was shown in the 50s, where it was elegantly demonstrated that testosterone, which is the male hormone, is required by the cancer cells for their growth and dissemination. So by reducing or eliminating testosterone from the man's body, we lead to the damage and destruction of the prostate cancer cells. And this can be done through various methods. Surgical, by surgical castration, which is removal of the testicles. Testicles are 95% of the source of testosterone, one-time surgery. Or it can be done by chemical castration, which is giving hormonal injections on a regular basis to reduce the testosterone levels in the man's body and kill the cancer cell. In addition to this treatment, which has now been around for about 30 years, we have novel hormonal agents, which are essentially tablets, which further reduce the testosterone in the man's body and lead to the death of the cancer cells. Having said that, and having said that the treatment is very effective, there are associated side effects due to the reduction in testosterone in the male body, but these can be easily dealt with. Chemotherapy has been around for 3-4 decades and is an important component of treatment of advanced prostate cancer. It's given as an outpatient, usually well tolerated, and is effective. Radiation therapy in the form of liquid radiation therapy such as radium-223 and lutetium PSMA-177. Essentially, these are injections which are given to the patient and contain radiation, and the radiation travels through the blood to all parts of the body where the cancer has spread to and kills the cancer cells. As I alluded to previously in my talk, some prostate cancer are associated with mutations such as in the BRCA gene, and these can be treated with targeted therapy. And lastly, in a select group of small patients, immunotherapy may be an effective modality of treatment for advanced prostate cancer. So many treatments available and well tolerated and highly effective. Now I will switch to the second part of my talk, which is on testicular cancer, and I won't spend too much time on this because this is a relatively rare cancer. It's usually diagnosed in young men between the ages of 15 and 45 years of age. It occurs due to growth of cancer inside the testicles. We know that the testicles are responsible for the production of the testosterone hormone as well as sperm. And what is important to remember, that testicular cancer, even in an advanced stage, is highly treatable and most often curable with chemotherapy. What about symptoms of testicular cancer? Mostly these include a feeling of swelling in one or the other testicle or a lump, a feeling of heaviness in the scrotum, a dull ache in the lower belly or groin, sudden swelling in the scrotum, pain or discomfort in the testicle, enlargement or tenderness of the breast due to hormonal production, and sometimes back pain due to spread to the lymph nodes in the belly. Of course, again, you may not have any of these symptoms, but in my experience, the most common symptom has been feeling a lump in the testicle by the male. It's unclear what the cause of testicular cancer is, but there are some associated risk factors, one of which is an undescended testicle, which is called cryptorchidism, and this is associated with a high risk of testicular cancer. Family history may play a role sometimes, and sometimes the ethnicity also plays a part. Testicular cancer is seen more commonly in young white men in the US as compared to black and Hispanic men. Diagnosis includes an ultrasound of the testicle, which is usually very accurate, a blood test to look at cancer markers such as beta-HCG, which is also called the pregnancy hormone, LDH, and alpha-fetoprotein, and of course surgery when the tumor itself is removed and evaluated under the microscope. That's the most accurate diagnostic method. There are essentially two types of testicular cancer, seminoma and non-seminoma. Seminoma testicular cancers tend to happen at an older age. They often grow slowly and spread less aggressively as compared to non-seminomas. Non-seminomas happen earlier in life. They grow and spread quickly, so they are more aggressive. And there are several types of non-seminomas such as choriocarcinoma, embryonal carcinoma, teratoma, and yolk sac tumor. Like we discussed in prostate cancer, once the diagnosis of testicular cancer is made, we do further tests to see the stage of the cancer with the help of scans and blood tests. Unlike other solid tumors, testicular cancer has 3 stages, not 4. Third stage refers to cancer that has spread to different parts of the body. But unlike other cancers, testicular cancer, even at advanced stage, is curable, usually with a combination chemotherapy. Surgery continues to be the first step to remove the tumor from the testicle and confirm the diagnosis. As I explained, chemotherapy is very effective in this cancer, especially a chemotherapy called cisplatin, which has been around since the 1950s. Radiation therapy can be used sometimes, and in an advanced refractory stage, we have also used immunotherapy with success. So I think that's what I really wanted to talk to you about prostate and testicular cancer. I'll be happy to answer any questions. Thank you.